as neutrality. Let me be clear. To global South, India, Kenya, Bangladesh, Nigeria, Ukraine stands with you. Decolonizing global health means your voice must shape decision making, not merely follow it. To our partner, UK, US, France, Ukraine follow your Ukraine values your support and accountability. Together we can build a system where oppose any attempt to hide geopolitical violence behind humanitarian language. The world cannot pretend to decolonize health while allowing colonization by force. Distinguished delegates, Ukraine remain unbroken. Our cities are scared, are scarred, our hospital tested. To ensure that no nation, present or future, must rebuild the health system from ashes to war. Thank you.
Thank you, ma'am. Now I invite the delegation of Russian Federation to kindly Thank you, ma'am. Now I request the delegation of Republic of Kenya to share their speech.
Honorable Chairperson, respected Secretary General, esteemed moderator, and distinguished delegates, the delegation of Republic of Kenya expresses its gratitude for the opportunity to address this on the critical agenda of decolonizing global health. The COVID pandemic exposed a long-standing truth. Global health architecture continues to reflect historical inequalities where access to life-saving tools is shaped less by needs and more
charity to equity, as mentioned by the Honorable Secretary General. This delegation, therefore, supports a strengthened global architecture with binding commitments, predictable financing, and equitable technology transfer to ensure that no nation is left defenseless. This delegation calls for predictable multi-year investments that strengthen national systems. Bangladesh stands ready to expand regional production networks so that vaccines, therapeutics, and diagnostics reach those who need them and not only those who can pay for them. Above all, governance reform is imperative with balanced representation, transparent decision making, and voices of the Global South equally shaping priorities. Research and knowledge production must be recognized. Distinguished delegates, geopolitical instability, climate change, and emerging diseases reinforce the need for international cooperation and predictable financing. Bangladesh seeks partnership, not sympathy, investment in capability and not aid, and more seats for the Global South at every table where decisions on health are made. This concludes this delegation statement. Thank you.
Thank you. Now I invite the delegation of Federal Republic of Nigeria to kindly address the Assembly.
Honorable Chair, esteemed Secretary General, and our distinguished delegates. The Federal Republic of Nigeria stands with a clear message. Global health must be liberated from outdated structures that continue to disadvantage the Global South. The COVID-19 pandemic exposed a painful imbalance. After Africa had received only 3% of the global's early vaccine, despite being home of 17% of the world's population. This is not an accident. It is an outcome of a system built on dependency, unequal decision-making, and concentration of pharmaceutical power in the hands of a few nations. We, as a recipient nation, strongly support for full TRIPS waiver. Funding has been donor-driven, not community-driven. Research has been shaped by Western institutions, not by the realities of the Global South. Nigeria believes that decolonizing global health requires 3 urgent actions. First, shifting from donor-driven models to partnership-driven cooperation, where countries like Nigeria have an equal voice in how funds are allocated and programs are designed. Second, democratizing WHO and global governance so African nations hold a real decision-making power. Third, building local vaccine and pharmaceutical manufacturing so Africa is no longer dependent on imports for 99% of its vaccine and most of the essential medicines. We would like to propose partnership-driven health governance, local pharmaceutical manufacturing initiative along with the full TRIPS waiver. Thus, Nigeria calls on the committee to build a global health order where power is shared, access is fair, and every nation can stand strong on its own foundation. Thank you.
Thank you. Now I request the delegation of World Bank to share their speech.
Honorable Chair, Honorable Secretary General, and distinguished delegates, greetings. The post-COVID period has demonstrated that global health challenges rapidly evolve into economic and social crisis. While progress has been made, is deeply concerned that ongoing conflicts across regions continue to inflict unacceptable civilian casualties and destroy health infrastructure, recurring decades of development gains. Financing alone is not enough. Global cooperation is. Are the members prepared to work collectively, sharing resources, technology, decision-making authority to build a truly inclusive and equitable global health system? Thank you.
Thank you. Now I invite the delegation of World Health Organization to offer their words of wisdom.
honorable members on the dais, and the delegates. After years of global crisis, I asked a simple question: what have we learned? For decades, the WHO has led the charge. Today, we call on every member state to stand with us as we lead the necessary evolution toward a system that is shared and with equitable leadership. Today, we confront the colonial foundation of global health. This is not a debate, it is a definitive call to action against broken system. When the pandemic hit, the global south was left begging. Health cannot be negotiation where necessity equals surrender. This system is broken and its repair starts with structural sovereignty. The flow is clear. We run the world's health on 14% commitment by the member states and 86% charity by the generous donors. Our current funding model is a colonial relic. This shackles our integrity and allows 4/5 of our work to be dictated by the few donors and their agenda. We cannot lead when we are forced to follow the money. Money makes the world go round, and when the WHO relies on charity, our orbit determines by others. Let me be clear, relying on the bilateral agreement is short-sighted diplomacy. Your national health security lasts only as long as you remain in the good books of the dominant powers of the world. One small geopolitical nudge and your access to life-saving supplies vanishes, leaving the citizens vulnerable. It is strategically sound and morally correct to invest your national energy and resources in WHO strategy and collective structure. Here, we are at the structural reform. We set the agenda and suggest the solution for sustainable financing by increasing 50% of the mandate. We urge all the member states that by 2030, 50% of the funding of the WHO comes from the member states so that we don't have to rely on the donors. Second, the permanent equity, that is the pandemic agreement.
Please conclude.
Thank you. And I request all the member states to come on board, increase their investment in the World Health Organization, and let the World Health Organization pave the way for equity and equitable distribution in the world. Thank you. Health for all.
Now, the floor is open for the moderated caucus for 10 minutes. Please raise your flag.
We want new member states, those who already contributed. China, France, and Nigeria, Russia. Nigeria. Okay.
The delegation of Nigeria.
Honorable Chair, distinguished delegates, so the Federation of Republic of Nigeria rises today with a clear message that global health must transform from a legacy of dependency to the future of dignity, equity, and shared power. So the Federal Republic of the Nigeria would like to motion for a moderated caucus focusing on partnership-driven healthcare governance and local pharmaceutical manufacturing initiative. For decades, health programs in Africa were structured through donor-driven models, designing in foreign capitals, implemented with foreign priorities, and often detached from the realities of our people. Today, over 75% of Africa's health funding comes from donors. So we would like to propose this motion. Thank you.
For how many minutes and with whom?
So we would like to propose this motion for 10 minutes.
5 minutes.
5 minutes. We would like to propose for 5 minutes. And we would be liking to take US and India along with us for the proposal.
Any opinions? United States. You have 1 minute for putting your stance.
the delegation of the United States accepts what the delegation of Nigeria has currently stated. This is what we initially started with. We do not allow countries to not be self-reliant anymore because in the times of crisis, there is nobody to help them. In reform discussions, there are always speeches made, but when the time comes, the agreements are basically on paper and not on ground. So I believe the United States had proposed this agreement when the MUN meeting started. We do not want the countries that are dependent on us to be dependent anymore. We want them to be self-reliant, and any country that would require help in that for regional manufacturing and to become a hub themselves, the United States delegation would be ready to help. Thank you.
Any opinions? The Russian Federation.
The South and the global North have been very capable of inventing multiple malaria diagnostics, ORS from Bangladesh, so we don't need Western permission anymore to organize global health. WHO has already been held captive by the G7 crisis. We build independent South health capacity. Unlike the Western approach, we attach zero conditionality. This crisis that the 80% of global health disease burden is there in Africa and Asia proves that WHO cannot deliver. We would propose to create a new institution focusing on Asia and Africa where there's open membership and again focusing on zero conditionality. Thank you.
Any opinions? China. US. Yes. Please reply.
So the delegation of Russia, I hear what you say. The delegation of United States would like to state that it is very easy to talk when the assessed contributions are not part of your entire economy and your assessed contributions do not lead to decisions in WHO. Rather than making an entirely new institution, why don't we work on developing the existing one? Why don't we work on reforming the existing one? Do we not believe that the decades of work that WHO put in can just be asked for accountability and all the countries can still benefit from that? Do you believe that the delegation of Russia would take the responsibility and the leadership in building a new institution altogether? Do you believe that discarding the decades of work of WHO in leading global health and helping countries for decades altogether can just be dismissed because you simply cannot ask for accountability and you simply also cannot provide assessed contributions? Thank you.
WHO.
The WHO would like to address the remarks made by the Republic of the Russian Federation. The WHO has always been the pivotal force for the world health, for the global health. And on top of that, the current situation that is that we have to focus on is the assessed contribution, which makes up to 14% of the World Health Organization's funding. So I urge all the global South to increase their investments into the World Health Organization so that World Health Organization can deliver in a better way to the world and make an equitable distribution to for the nations. And the allegations made by the Russian Federation do not hold true, that the World Health Organization was not pivotal in the global health.
The delegation of China would like to speak.
Then Russia. Final argument.
The delegation of China would not like to put any kind of allegations on anyone. What we suggest is and advocate is weighted voting reforms reflecting population need and not GDP dominance. So we want amendments in WHO charters for 30% developing country seats in executive board and veto power on inequitable policies.
The delegation of France.
The delegation of France has always been one of the countries to establish peace between nations when there is any kind of conflict. We would like to try to do the same over here. France has always continued to support the WHO in all its endeavors along with as being part of the G7 summit.
It's easy for every country to want to move out of donor-driven partnership, donor-driven charity and ask for partnerships, but like the delegation of France and many other delegations present here, we've been asking for bilateral talks and participation in building regional hubs, but no country or no delegation seems to agree with that. So it's very easy, I think, to want something and then not participate in it when there is a country offering to help. So I feel like the delegation believes that the Global South needs to reconsider what they mean when they say they want partnership and not donor-driven charity. Thank you.
You are confusing the world. With whom you are, Russia or USA?
So this was directed at Russia. We stand with USA as we always have.
Final remarks from Russia. You will get the chance.
USA, you will get chance.
Iran will also get chance. Fine. Russia would like to reply?
In response to my US delegate, Russia would definitely want an open donation campaign, and we pledge $200 million, inviting other South nations to contribute, bypassing the G7 gatekeeping. And we would also invite partnerships from African health programs, Indian, Asian, and from the Chinese, bypassing the WHO. BRICS Bank allocation would bring in dedicated health lending window with no conditionality like we earlier proposed. And we would also want to have the emergency South-led fund, which would be a parallel health fund with a seed capital of 500 million with India and China. Thank you.
Islamic Republic of Iran.
Honorable Chair, distinguished delegates, the delegation of Iran stands in full support of Nigeria's efforts to strengthen local pharmaceutical manufacturing. Access to life-saving medicine must never be dedicated to monopolies or restricted to patents. Developing countries, including Nigeria, must have the capacity to produce essential drugs locally, ensuring affordability and resilience during health crisis. Iran believes that through South-South corporations, locals can share technology and expertise pharmaceutical productions, establish regional manufacturing hubs, ensure equitable access to vaccines and medicines without dependency or monopoly on supply chains. We call upon all the willing nations to support Nigeria in this critical initiative and to work together to empower developing nations to protect public health and strengthen religion self-reliance. When nations cooperate, health becomes a right and not a privilege. Thank you.
Final remarks from United States in 1 minute. Ukraine.
If Ukraine want to speak anything, special privilege 1 minute. Because Russia has put forward this.
The delegation of United States can pass on the privilege as well. So, the delegation of United States could not help but excuse a remark made by the delegation of China in order to allow the Global South to have equal votes on unequitable policies despite their assessed contributions. I would like to remind that the votes have always been equal, whether the policies are equitable or not. If they're talking about influence and not votes, 47% less assessed contributions than USA, despite the growing GDP of China for several decades. Are they protecting Global South or protecting themselves? This is an answer that the delegation of United States would want from the delegation of China. Thank you.
We have 2 more minutes. Any nation wants to opinionate anything? All right. China.
As the delegation of USA mentioned, we are not protecting ourselves. We would like to state some facts. Unlike US single veto, we see population-based equity reflecting 85% of world's population. That is why asking for representation on unequitable, I repeat again, on policies which are not equitable, we are not wrong in any way.
Last 1 minute. France have raised the placard.
You have spoken so many times.
Let the other
Sanjeev,
nation
you want to?
speak.
Ukraine. Nothing to say? You also. Okay, so we are concluding
We are
this purpose.
concluding this moderated caucus. Now the floor is open for the ministerial roundtable conference. Nominate your ministers. It is a 10-minute event and will be unmoderated. You can leave your places, but you will be judged on your stances. You have 5 minutes to form alliances and discussions, and the rest 5 minutes to take your stance. Thank you.
One announcement. After the ministerial roundtable, we will have bilateral talk for 5 minutes, and for the rest 5 minutes, we will have a moderated caucus with open-ended questions, no topic to be assigned to the moderated caucus. You can directly question different countries on different stances, or if you feel that you need to ask a specific question to another country, you may do that in those 5 minutes. Thank you. The last minute to form your alliances. Delegates, please return back to your seats. The next 5 minutes is for discussion. Please return back to your seats. Delegates, please return back to your seats. Delegate of France. The next is an announcement. Yes, thank you. Esteemed moderator, please return back to your chair. Can we have a show of placards who would like their ministers to come and speak? France, India, USA, WHO, and Iran. France, please come forward. Followed by India, USA, WHO, and Iran. Keep your speeches very, very short.
Respectful dignitaries and delegates, France has looking forward to make alliance with other countries like the Nigeria, Kenya, and UK and Iran for the regional hubs and development, and even Ukraine including. We look forward for the 50% resolution for the giving equal rights, partnership, and emergency waivers at the time of pandemic and crisis, so that they can, as a nation, they can develop themselves and they get equal rights when in such crisis. Thank you.
Thank you.
So for the delegates of India, for Bharat, we have formed a multilateral alliances with respect to TRIPS waiver, joint manufacturing, which is supported by WHO. Also with Russia and China for Global South for democratizing and data leadership and data protections. Thank you.
Delegate of USA.
Honorable Chair and esteemed delegates, the delegation of United States is offering to Ukraine, India and Nigeria APC waivers at a time when many global actors are busy guarding their intellectual assets. We are choosing a different path. We believe that access to knowledge shouldn't depend on countries' economic standard and that genuine progress comes from opening doors and not closing them. Also, the US is funding $2 billion to Nigeria for health and research programs. Thank you.
WHO.
Yeah. Delegation of WHO.
Delegation of WHO.
A reminder that all the ministers will speak and have a very, very short stance. Respected dignitaries on the dais and my distinguished delegates, as discussed with the Republic of Bharat and the Republic of France, Nigeria and Kenya, WHO will be supporting local capacity building hubs with the alliances formed between those four countries in response to them backing WHO's agenda for 50% of assessed contributions by 2030. WHO will also support France for technical guidance in response for their delivery of raw materials for medicine production. And in response to that, WHO will support the Republic of Bharat and the Republic of France in the mRNA vaccine hub for the WHO's mRNA technology transfer program, and will also help the Republic of Bharat with their digital leadership program from for ABBA, that is Ayushman Bharat's digital mission. Thank you. Delegation of Iran. Honorable Chair, distinguished delegates, the delegation of Iran proudly supports Nigeria's initiative to manufacture essential drugs locally. We are pleased to collaborate with the World Health Organization, which has provided the necessary approval and guidance to ensure this local production meets the international standards. Iran is committed to providing raw materials, technical expertise, and training to help Nigeria establish a strong and self-reliant pharmaceutical industry. We urge all the delegations to support this initiative so that nations like Nigeria can protect public health, reduce dependency on monopolized supply chains, and build religious resilience. Thank you.
Next delegation, Nigeria.
A reminder to keep your stance very short. UK, please be prepared. Delegation of UK.
Honorable Chair, distinguished delegates, so we are happy that our proposal of partnership-driven and local production of the medicines has been accepted by United States, India, UK, China, Iran, France, and we also appreciate United States for giving us US aid of $2 billion for local production and research. So we also like to thank France for partially agreeing for the TRIPS waiver. So we would also like to thank Iran for supporting us with all the proposals we had proposed. And we also like to thank Bharat for giving us local production and also for the medicines which they have helped even during the COVID. And we also like to thank China for helping us for the proposal. So thank you.
Delegate your time. UK.
Delegation of UK. Delegation of World Bank, please be prepared.
Esteemed Chair and respected delegates, we would like to put forward a stance regarding the alliance we have formed after a lot of deliberations with Saudi Arabia, France, India, Bangladesh, Kenya, Iran, and Ukraine on the stance that we will support technological development and manufacturing hubs in the regions that they ask, waivers only while prioritizing uncolonized healthcare and supporting and extending support in emergency conditions, but we do not support complete waiver. Here I would like to make a point that we do not support blanketed waivers. We also propose to extend support to WHO regarding this stance. And I would also request Nigeria to take into their considerations. Thank you.
Delegation of World Bank. Delegation of China, please be prepared. Honorable Chair and esteemed delegates, the World Bank cannot directly pay the WHO's assessed contribution, as these dues are responsibility of the sovereign member states. However, this delegation emphasizes that the World Bank can indirectly support WHO's demand for the 20% increase for providing fiscal space, budget support and aligned financing to the lower and middle income countries, enabling them to meet their obligations while strengthening the global system. The World Bank is also ready to assist the Ukraine with substantial financing, but this delegation emphasizes that the USD of 5 billion package must be tied to strict transparency and international monitoring to ensure the aid truly accelerating the national recovery. Thank you. Delegation of China. Greetings to respectable dignitaries present over here. China has made alliance with India and Russia with moderated data sharing, who has asked for it and will definitely help it with this collaboration. China will definitely appreciate on South-South collaboration with all the countries of Eurasia and South Asia. China will provide pharmaceutical support to Ukraine in terms of the return of agricultural reforms. China would, with respect to help the digital help to other countries from the European Union and the African Union. Thank you. Delegation of Russia.
Honorable Chairperson, esteemed Secretary, and my fellow delegates, we proposed democratized WHO and Global South from parallel organization. Enough of Western and G7 control. So for that, Bangladesh, Kenya and India supported us, and we love to contribute from other countries because G7 nations retain 80% voting power in WHO and World Bank, despite representing 50% of global population and bearing 30% of business burden. This is colonial governance. We propose shift voting to population weighted and business burden weighted model. Thank you.
Delegation of Ukraine.
After Ukraine, I think we're left with Bangladesh. Bangladesh already spoken? Minister. Okay, so after this Bangladesh, then Kenya, then Nandita. Okay, Saudi Arabia.
Respected Chair, General Secretary and distinguished delegates, I would like to thank our alliances. We have made alliances with United States, France and UK for the betterment of health facilities in our war-affected regions, and we are happy to announce that World Bank has supported and given us $5 billion for our health facilities. And we have also been able to make alliance with China. Thank you, delegates. Thank you. Delegation of Saudi Arabia. Delegation of Bangladesh, please be prepared. Honorable Chair, respected Secretary General and esteemed delegates, Kingdom of Saudi Arabia is in concert with China for technology transfer and also in support of decolonizing research for proper visibility, and stand with China for equal voice for South Bloc in the WHO and the World Bank. leading to more influence of the global south in decision making and the policies making regarding the key issues that is happening in the world. And for empowerment and research equity also, we believe that countries should design and run their own health programs, not through the influence of the outside donors, because communities knows its own needs the best. Global South still gets less voice despite carrying most disease burden. So we are open to constructive dialogue and practical proposals and spirit of solidarity so that no other countries are being left behind. Thank you.
Delegation of Bangladesh. Are any countries left to speak? World Bank? No. Honorable Chairperson, we are in support with Russia for the Global South collaboration, and in return we are receiving heavy funds and technological support, and we hope that you continue to do so. And we would also like to appreciate China for the South-South collaboration, and we are totally in support with that. Thank you so much.
Kenya.
Delegation of Kenya.
Honorable Chairperson, the delegation of Kenya is pleased to represent our alliance with UK, Saudi and Iran for the equal representation of Global South in institutions and for minimizing the veto power of Global North in case of emergencies. Our alliance supports the waiver of trips in emergency situations and also for the for local production, improvement of local production capabilities. We look forward to talks with Bharat, the Republic of Bharat, in our unmoderated caucus. Thank you.
So we have received several proposals for multilateral and bilateral talks. So now I request protocol officer to initiate the multilateral talk. We have received two proposals, and chairman has already approved the same. We have also received bilateral, but we have not been able to take up this. So we'll request those who have proposed, they can speak. We'll give chance in multilateral talk.
For multilateral, we'll only be having 5 minutes because we're running very, very short in time. One request is from Republic of Kenya. They want to have a talk with India, UK, Saudi Arabia, Iran, and Nigeria. And the second multilateral talk is by India with France, Iran, Kenya, Nigeria, and supported by WHO. Please go ahead. We will have only 1 minute to give your stance. Thank you.
But I also request US and Russia to also put forward their points.
Only 2 minutes for discussion, please.
Delegates, please note, we have 2 minutes for the first multilateral talk by India, and once you are done, India comes and presents.
After any of your represent India.
But let India present, and after that is done, the second multilateral talk by Kenya begins. Please note.
Last minute for discussion. India, please come for a stance. Time's up.
Delegate of India, please come for your stance. We are short with time. Great. Delegate of France, please come and put forward your opinions. We request you to come on time, the delegate of France, because we are short on time.
Greetings, not taking much time. The alliance between the countries of UK, Bharat, Iran, Nigeria, Kenya, with full support of the World Health Organization, have been working on regional manufacturing hubs for essential health services. The pointers for which are decentralizing the production of vaccines and critical health commodities in all partner nations, prevent any future supply shock, which is the main motive of this. Countries with strong scientific capacity must allow walk-in knowledge transfer into partner countries, which will be on a rotation basis. Identifying one African and one Asian hub for these manufacturing centers or hubs. Regulations as per the World Health Organization rules. Workforce training will be provided again on a rotational basis in all the member partnership countries for ease of tech transfer. Blended financing options as agreed by World Bank to make hubs viable and resilient, and equity and innovation will be provided in all these partner nations because of these regional manufacturing hubs. Thank you.
Why you are excluding the two global power, US and Russia? We will definitely.
This was an alliance that the European partners of the global north had worked with to support our friends in the global south, and this is an alliance the United States is welcome to join, provided you allow the transferring of patent rights that France and UK are very happy to let go.
Thank you. Yeah, USA, please.
The delegation of United States would like to remind the delegation of France, who were the first ones to protect their patent rights and their intellectual property rights. United States still stand by their stance and would not allow complete favor on intellectual property rights, and still do not understand how a multilateral talk about a vaccine hub and workforce being provided on a rotation basis was done without the allowance and without the opinion of the delegation of United States. We still agree. Just a second. We still agree.
But I wish to answer, so just a second.
Let her speak. Yes. Since the delegation of United States was not invited to the multilateral talk, we request that our time is not taken away when given a chance by the chair. Also, the delegation of United States would like to provide open funding to the Global South. The Global South and North collaboration for vaccine production, apart from the controversies that we have been in, and apart from the geopolitical tension in times of crisis, the delegation of United States will always be there. Thank you.
You have to introspect why Global South is leaving you. Please, Russia.
It really amazes me how USA stands here to contribute into all these visions while already withdrawing all the HIV funds from the LMICs. And coming to France, you already have the monopoly on the pharmaceutical profits, and again, like she mentioned, on the IP rights. So how do you envision to bring in the global health sovereignty in this? Sorry. So we here stand as the Russian Federation, again focusing the whole gathering on multipolar health system where 150 or more nations have a voice, not just 5.
Thank you.
The delegation of France would like to reinstate their stance. We do not believe in a complete waiver, as we are not agreeing, as none of the partners in this alliance are. We do not agree on a complete waiver. We probably never would. It is not in France's best interest to do so. Having said that, this idea of a regional hub is only there to help our partners in the south. This alliance was put forward for the entire assembly, and we feel that like-minded alliances can be multiple in number. It does not have to be just one single alliance that comes out of this assembly today, and we welcome all of our partners in the north to join us in further alliances, as we already.
Thank you. Please yield your time.
Thank you.
We move on to the next multilateral talk by Kenya. You have exactly 2 minutes. Because we are short on time, please take 2 minutes to discuss and then come and present your stance. All the delegates, please note that immediately after Kenya, we will be moving on to drafting of the resolutions. So please be prepared while the multilateral talks continue. Delegate of Kenya, can you please come and present your stance? We request all the delegates to please return to order. Delegate of Kenya, please present your stance in 1 minute.
The delegation of Kenya is delighted to present our alliance for advancing the interest of Global South in governance and democracy in global institutions such as WHO. We are in support of increasing the assessed funds of WHO by up to 50% by 2030. And we are also looking to set forward a Global South Research Center hub to generate research specific to the Global South and to define our own research and health priorities. We are in support of waiving of trips in emergency situations for a period of 1 year. The waiver will be triggered by neutral agencies such as WHO and can be extended in Global South and in priority states for a slot of 6 months or one year. And we are also proposing improvement of global regional capacity building in the Global South.
Okay.
Thank you.
So now we are moving forward towards resolution. Please draft the resolution and come up with, then we will have voting and veto.
If any of the delegations have their resolutions ready with them, they can come straight away and present. Can we have the timer for 5 minutes, please? This is the last round. Reporter, you want to speak anything? Ajay. Delegation of USA.
Good afternoon, dear Honorable Chair, distinguished members and fellow delegates. I thank you, Honorable Chair, for this opportunity. As a journalist from the Nexus Global News, observing this important discussion, Honorable Chair and distinguished delegates, I have questioned to some delegates on discussion that we did so far. So my first question is to Delegation of India. Dear Delegation of India, you correctly asserted about TRIPS waiver, that IP restriction fueling global inequity. Yet, critical observation, there is a significant contradiction in India's own policy that even while campaigning for a global TRIPS waiver, the private developer like private company Bharat Biotech, they were domestically funded Covaxin and they were filling patents, omitting government's scientists and government itself. So, my question is, the Republic of India's demand for the global TRIPS waiver truly a selfless stand for the global south, or was it a calculated diplomatic maneuver designed to challenge the US-led global IP framework, while simultaneously maintaining the domestic IP policy that prioritizing the commercial exclusivity of your own private vaccine producers?
India can respond. Delegation of India.
The Delegation of India thanks the reporters from Nexus News for this wonderful question. In response, we would like to emphasize that while the COVID-19 was a challenge for everyone, India had its own significant challenges with regards to the local context and had to respond as we could. Now that we have learned from our mistakes, we are not requesting for TRIPS waiver completely. We are always in favor with what our friends in the West are always emphasizing, that TRIPS waiver would only be applicable during the emergencies that happen. And we are also in deliberation with our multilateral partners that this TRIPS waiver, which kind of emergency is to be categorized for this, can be done by a neutral body like WHO. We are in time of writing the same resolution, and if it passes, that would be a huge deal for all the member states present.
Thank you, India. You have any more questions?
Last question.
For whom?
Last question for the US delegates. Dear delegation of the United States, you speak convincingly about empowering nation towards self-dependence through local manufacturing. However, real-world data demonstrate a stark contradiction. Your current economic policy employs increasing tariff and new regulatory fees on foreign manufacturers, all while offering significant tax breaks. So my question is, if the United States is truly committed to self-dependence in Global South, why are your policies designed to financially penalize and discourage the very global supply chain diversification and local capacity building you advocate for in this assembly? Isn't it look like the stand for goal of helping other manufacturers, but the ultimately goal is to manufacturing dominance in the world by increasing the tariff?
Thank you for the amazing question. The delegation of United States would like to answer just one short thing. There were policies that were designed, you were speaking of, and are not existing currently, which is why we are presiding this meeting. So the Global South collaborations particularly comes in the way where I have been asking questions that the delegation of United States needs something in return. The delegation of United States has never said that we are ready to provide without exchange of anything. In order to make the Global South countries self-reliant, they need to provide. And if they are providing to their funders, I do not see anything wrong in that. The policies, the existing policies say exactly that.
Thank you, USA. Thank you. Mr. Reporter, you are, okay. Done with your questions? Do you have any further question? Okay, thank you. Pressure group?
After this, we'll have a presentation of resolutions. We have two resolutions, one from the delegation of USA and one from the delegation of Nigeria. Those are
India.
we are taking.
Resolution? Submit.
Honorable Chair and Distinguished Delegate, Doctor Without the Borders take the floor today not as a nation but as a reminder of the people who do not sit in this room, who have no flag, no embassy, no negotiation leverage. They are the displaced in the conflict zones, children in the famine-affected regions, and the injured left behind after the floods and earthquake outbreaks. They are the fate shaped by their choice, but by the geopolitics. Today the agenda is not for the technicalities of moral. Access to the healthcare should not be the use, bargaining the chiefs, and the humanitarian corridor must be the protected, the medical neutrality must be the upheld. We argue the state to the priorities, unrestricted humanitarian access during the crisis, rapid funding and the mechanism that do not wait for the bureaucracy while their lives are lost, including the migrant stateless, and the refugee, the population in the health system without the discrimination. We are not for the here the challenging the sovereignty, but to the reminder that with the sovereignty comes the responsibility. Human lives cannot be divided into the ours and others. Delegates' history will judge not only for the what decisions are made, but how quickly they are made. Consensus should not come after the tragedy; it should prevent. Doctors Without Borders remaining ready to act, trade, witness. We ask this room to ensure that we never have to choose which lives to save because the world could not agree in this time. Thank you so much.
Okay. Pressure group? Okay, thank you. Thanks for your time.
We are taking the first three resolutions submitted to us. The delegation of USA, the delegation of Nigeria, and the delegation of Russia. Delegation of USA, we request you to come here and present your stance in 1 minute and 30 seconds for voting. Put to vote. So after USA is done presenting their resolution, we would have a raise of placards in support or refrain.
Honorable Chair, esteemed Secretary General and my fellow delegates, this has been an absolute honor to sit with you beside this meeting and understand what the Global South exactly needs and what complaints the Global North exactly have from us. So the joint agreement stands on what we started with on a partial TRIPS flexibility. I understand the Global South demands complete waiver, which was a demand that Nigeria put forward with us, and the delegation of Nigeria has agreed to partial TRIPS flexibility now in case of emergencies. Unlimited resources for man-force, medicines, drugs and vaccines would be provided to the Global South countries, to the Global North, like countries like India and France who are on board with the joint agreement. They have agreed to provide us with strategic and technical partnership, and the vaccine expertise that India holds, Bharat holds, would continue to lead the way, and the resources and funds being provided by the United States. I would like to reiterate, the countries on board with the joint agreement are Nigeria, India, France. Thank you.
Put to vote.
Those who support, please raise your hand. Those who support USA resolution, please raise your hand or your placard. Bangladesh, abstain. Iran, abstain. China, it's always. 12 are supporting. 7 are supporting out of 12. Yeah, it's 12. Russia, you are abstain or against? Abstain? Good, so kind.
The resolution is passed.
The resolution is passed. Congratulations, USA.
delegation of Kenya, sorry, Nigeria, delegation of Nigeria. You have 1 minute to present and 30 seconds put to vote.
Honorable Chair, distinguished delegates, we, the Federal Republic of Nigeria, are here to put forward our proposal for two resolutions. One is partnership-driven health governance, and that is solely because African nations rely on our donors for almost 75% of our health financing, and donor-driven aid weakens the national autonomy and only creates duplication. And our second resolution is going to be local pharmaceutical manufacturing initiative, because almost 99% of vaccines are imported and we must move towards a self-reliant nation as a representative of the global south. So these are the two resolutions that we put forward to vote. Thank you.
Put to vote. Those who are supporting, please raise your play card. Kenya, UK, France. Against or abstain?
Both the resolutions are being put to vote. Or individually?
One. You now one. Okay. So how many are supporting? Please raise your play card again. 1, 2, 3, 4, 5.
Partnership-driven health governance. Partnership-driven health governance, our first resolution. We put that to vote.
It is passed. Thank you.
Thank you.
Now, next one. Russia.
Delegation of Russia. In the times of sanctions, withdrawals, and a lot of things going on, we propose to democratize WHO and World Bank decision-making structures. We would focus on shifting the votings to populated-weighted and disease-burden-weighted model, mandatory 50% Global South representation on all executive boards, removing veto powers, and establishing an independent Global Health South Fund if all of these agreements are not met. The US's ties always held care to regime changes, be it Venezuela, Syria, or Cuba. France has always imposed neoliberal privatization via World Bank conditions. UK enforces the IMF austerity. Healthcare collapse in Africa is a big example for that. So, I would urge to focus on all our fellow delegates here, especially Nigeria, to focus where we are going. We would emphasize having a parallel health fund of 500 million seed capital, and we would focus on WHO ultimatum to reform the board structure.
Thank you. Put forward. Those who are supporting, please raise your play card. 1, 2, 3, 4. Nigeria? Not supporting? Under pressure of USA?
Exactly what
China is supporting. Ukraine? Naturally. One, two, three, 4, 5, 6. Maybe 5 है ना? 1, 6.
So Nigeria really wants to, they are under pressure.
They are not supporting. We have not given the fund. USA given 1 billion fund.
They never came to us.
It's deadlock. So you discuss with other countries, and the next MEN we will put forward this resolution. So if the resolution put on hold, it's deadlock. Thank you.
Thank you. I request the chairperson for this. Okay.
Please, Delegate of France, you are using your veto. Okay, please provide your justification.
two pointers that were put forward. One, weighted population on the basis of population, I think. I'm not sure what the proper structuring of the sentence was, but obviously it meant that on the basis of the population. And two, 50% to the global south is something we cannot agree with as the delegation of France, because that would, of course, not help countries with a lot of scientific power, with a lot of scientific contribution, but we are not geographically very large, and we are not the only country also. So because of this, I feel like there would be an imbalance in power if such resolutions are passed, and thus we would like to veto this.
Anybody else wants to use a veto power, or can we pass on to declaration?
Abstain.
Russia?
You want to answer? Okay. 30 seconds.
The focus of power is exactly what we want to dilute here. And when it comes to being the question on 50% of funds, we exactly focus on from where your disease burden is coming from. It has always been on conditions, and it has always been about power. For once, we want this to be about decolonization.
Okay, thank you, Delegate of Russia. Considering the voting and the veto used, we are not passing this resolution, but we would take up this matter in the next UN Assembly.
Thank you.
I would now request our chairperson, Dr. Shravan Chandji, to put forward his closing remarks.
Distinguished delegates, colleagues, and the members of the Secretariat, as we bring this assembly to a close, I would commend each of you to the depth, clarity, and conviction you have brought today's deliberations. Over the course of this session, you have not only debated policies, but you have engaged with the very foundations of the health systems and questioned long-standing structures that have shaped our world for generations. Your intervention today has reflected a shared understanding that decolonization is not just an event, it's a continuous process. I witnessed thoughtful reflection on dismantling long-standing power asymmetries, calls for greater representation in global health governance, and powerful arguments on shifting from donor-driven agendas to genuinely collaborative partnerships. During the crisis simulation, you have demonstrated urgency, solidarity, clarity, and strategic thinking, which is important to tackle global health challenges. Your ability to form alliances, craft emergency directives in short span, and respond collectively speaks to the future leaders that you are becoming. The resolution that you have drafted, the two resolutions, though symbolic, they reflect a maturing understanding that global health can no longer be shaped by supremacy, but it must be grounded in equity, shared accountability, and mutual respect between the nations. If our world is to move forward, these principles must guide not only negotiations, but as well as implementations. As Chair, I have been inspired by your professionalism, your diplomacy, and your willingness to challenge assumptions while upholding your decorum. If today's session is any indication, the future of the global health is in capable, thoughtful, and courageous minds. With that, I formally declare the proceedings of this assembly closed. Thank you, and I congratulate each and every one of you on a meaningful and impactful debate. Thank you.
Thank you, sir. I would like to thank our chairperson, Secretary General, Protocol Officer, Moderator, and delegation of all the countries. Now I request Protocol Officer Dr. Prayukta to felicitate Chairperson Dr. Shravan Chandji. Moderator Dr. Prashul to felicitate Secretary General Dr. Mahavir Gorecha.
everyone for your presence, and I request everyone on the stage to be present for the photograph. All the delegates on the stage, please.
I request everybody to join us in the auditorium for our next segment, that is the debate competition. Everybody please join us in the auditorium as soon as possible. We are about to start the debate competition. Thank you everybody for staying with us.